Hi, everyone. Welcome. We're going to be talking about diabetes and our nervous system and the correlation between the two. And this comes from an article by Dr. Jockers about how type 1 diabetes improves with chiropractic or can improve with chiropractic. If you have any questions, please feel free to give Dr. Justine a quick text and she'll be happy to answer you. I wanted to welcome Justine here with us this evening. So she is a passionate warrior for your health. She's a chiropractor, a wife, a mother of two amazing adult children. And she is our leader here at Justine Blainey Wellness Center. Please help me welcome Dr. Justine.
Hello, everyone. We've got a great topic today. We've got amazing exercises coming up with Jordan and Jasmine, our co-op students, who are going on to becoming chiropractors in Chiropractic College. We have some great talks with Dr. Udani on autophagy and anti-aging, followed by an interview with Dr. Peter Amlinger, long-term friend, and who adjusted me before I even was a chiropractor. And we'll be talking about innate intelligence. That's amazing intelligence inside of you and the 33 principles. So great stuff coming up. Today's article is from Dr. Jockers. And how does chiropractic play a role with diabetes? When we look at type 1 diabetes, it is autoimmune. It can affect the immune system, destroying the cells in the pancreas. It can start at a very, very early age, even, 4 or 5 years of age. And unfortunately, it's becoming more and more common. They don't know the exact cause of this, but they do know that the immune system, stress, and the environment can affect and increase your odds of getting it. There are different ways to diagnose, determine if you have type 1 or type 2 diabetes. You would see your medical doctor or your naturopath. You would do history, some blood work, looking at your inflammatory markers like A1C, homocysteine. You would do some glucose testing, some antibody testing, sugar levels testing to determine your risk factors. When we look at some of the risk factors, some of them are in your environment, toxins like pesticides, herbicides, household cleaners. That's why we clean with vinegar. Some of the food allergens, things like cow's milk, gluten, soy, peanuts, eggs, can be triggers, especially if they're introduced early in life, and low levels of vitamin D3. So that's why we can test, and you can get vitamin D drops that taste like nothing. You can get vitamin D gummies that can make a big difference. One of the risk factors is looking at brachial plexus injuries. So in the actual delivery process, there can be a lot of pressure on that top part of the neck, and it can damage the first joints in the neck, can affect that vagus nerve, vagal tone, which can affect the vagus nerve, which is a traveling nerve that can go all the way down to your digestion. It can affect the brachial plexus, which are the nerves that exit through the neck, can affect down your arm, can affect your thyroid, can affect, therefore, affecting your thyroid can affect hormone development. There are 10 reasons why we want to make sure that kids get checked and everybody gets a spinal checkup. If you have a spine, get it checked. One is to make sure the nervous system and brain development is working well, to make sure there's great communication from your brain to the rest of your body. It's going to improve the overall well-being of a child, and by reducing stress, it helps their immune system. It reduces risk of colic or irritability. It improves the nerves to the lungs and helping with breathing, improves posture. It helps the nerves and blood supply to the head, affects focus and brain fog and concentration. By reducing overall stress, it reduces risks of behavioral concerns. And there's now been years of research and anecdotal studies about helping with enuresis, which is bedwetting, and helping with digestion. By reducing stress, it improves sleep, which helps every single function in the body. So the thing here is, when you look at these 10 reasons and many more to improve, for example, athletic performance, flexibility, range of motion, when we're checking and making sure everybody gets a checkup of the brain and body connection by making sure, are there areas of subluxation, and removing those areas of subluxation, that's irritation, pressure on the nerves, pressure on the spinal cord, our body's going to have less stress and therefore function better. So chiropractors reduce the stress on the body and reduce the stress on the nervous system. When we understand the neuroendoimmunology, so how our brain affects our endocrine system, which affects our immune system. Again, our brain and nervous system affects our endocrine system, affects our immune system. If there's an imbalance, if there's stress on the system, areas of subluxation, our body can't function as best. So again, the chiropractor is an expert in finding and locating subluxations and removing those subluxations to reduce the stress on the body and help that communication system. When our body's out of balance, that can be affected by the 3 T's: thoughts, traumas, and toxins. Thoughts, traumas, and toxins. So traumas, whether it's birth traumas, falls, or accidents, or repetitive on your keyboard or on your phone, damage to the spine and nervous system can cause subluxations. Mental stress, thoughts, whether it's from our environment, from it's the mom under stress, poor sleep, can affect subluxations, which then can affect stress on the system, affecting digestion, your immune system. Different types of chemicals, whether it's from the environment, what we breathe, what we eat, different types of medications or chemicals that we clean with, again, can cause damage to the spine and nervous system, diminishing that life force, that energy that travels through your spine and nervous system. And so the goal of the chiropractor is to reduce that stress, help our body be in a more balanced state, removing and reducing the stresses of the 3 T's: thoughts, traumas, and toxins. Chiropractic care helps reduce the stress on the body, and there's been research on how it can help reduce inflammation. And inflammation can be monitored with your A1C blood work. I do recommend getting your blood work done with your medical doctor or your naturopath. And we do know that as you reduce stress on the body, it helps hormone function, it helps your immune system, it helps better cellular communication. So again, the chiropractor is reducing that overall stress on the body, which reduces overall inflammation in the end. So this is a quote: the nervous system is the master controlling system of our body. It creates communication channels through our body. And if those communication channels are fuzzy or distorted or damaged, it causes communication errors. So for children or babies, ineffective communication from our brain to all the different organs in the body can affect how we play, how irritable we are, how we digest our food, how we are able to breastfeed, how we're able to sleep. And if there's communication errors and stress on the body, that can lead to delays, digestive concerns, asthma, behavioral concerns, low energy, troubles with concentration, and headaches. So our belief, and this comes from Dr. Jocker's article, is that everybody deserves a spinal checkup. If it's great, great. That's like going to the dentist and you have no cavities. Going to the eye doctor and you don't need glasses. Awesome. You still go get a checkup. So everybody deserves a checkup of their spine and the nervous system. Chiropractors look and check the nervous system. There's something called the autonomic nervous system, the automatic nervous system, meaning that our brain sends messages to your spleen and you don't have to think about it, to your adrenals, and you don't have to think about it. You don't have to make sure you send a message to your heart to pump or to digest your food. But if there's interference, an area that's distorting those messages, it can be silent. Only 10% of our nervous system is truly pain, no C-section. So we want to make sure that 90% is working great. So we have amazing technology, test history, and postural analysis, orthopedic tests to check, do you have areas of subluxation damage on the nervous system affecting that communication system, so that your body's under less stress and you're at less risk, and you're going to be able to manage different conditions, different diseases, things like diabetes in a better way because you're in a less stressed state. So stay tuned with us. Our goal is to help you be better. You have less stress. We do offer complimentary meet and greets to learn more about if this is for you. We recommend monitoring of your sugar levels. We recommend having a medical doctor, a naturopath on your team to review supplements, to review diet, review lifestyle. And we recommend that everybody has a spinal checkup and gets testing for any insensitivities or food or allergies, because that can affect your stress on your body and affect autonomic and diseases and stresses on your body. Our goal is to be on your health journey to help you. So that's why we have amazing talks every single year. So stay tuned with all of these talks coming up. We have many more and many on our website already on ways to manage stress, improve your sleep, to help your overall body manage diabetes better. Connect with us. We have many different ways, whether it's on Instagram, Facebook, YouTube, and on our website. Share this information with others. Our goal is to help you. We do all this volunteer. And of course, please help us with doing a review. Have a wonderful day, wonderful night, and we look forward to being with you on our next talk soon.